Hi,
Hi,
how are you?
good.
So, introduce yourself and tell us who you are and
Well,
what you
I'm
do here.
Dr. William Johnson. I've been in the natural healing field since 1949. I'm 83 years old. I'm still working. I'm working with the International Clinic of Biologic Cell Regeneration here in Tijuana and in other parts of the country or the world. And so we come down here and we have a procedure that we call actually, it's a cosmetic procedure in the sense we give cells that enables the body to regenerate, not just to rejuvenate. And so this is a procedure that was started in Europe by Dr. Paul Nahans back in the 1930s. And Dr. Smith went over there and studied at the University of Vienna and then came back here and we commenced doing the cell therapy in 1981. And I was his first patient. And I responded. I was 51 years old at the time, and I responded well. I had allergies all my life, had hypoglycemia, and that was eradicated completely. And so I was free of the torment from having low blood sugar and having to eat every 3 hours and not having allergies anymore. So I became enthusiastic about it and talked to my patients and referred a lot of patients to the clinic. And then a number of years ago, Dr. Smith asked me to join him and work in the clinic besides sending patients. So I proceeded to do that, and I went down to the Bahamas and went to Matamoros, Mexico, and came here to Tijuana and worked with him. And then he died 5 years ago, and then his wife, Judy Smith, and my wife, Leslie, we decided the way to honor him was to continue the work, which we have done. And now we're going out of the country probably 6 or 7 times a year to do the procedure. And we aren't treating specific conditions. I call this a health enhancement program because that's what we work with. Everybody has a degree of health, and they concentrate on their diseases, but we don't focus on the disease. We analyze and see which systems are functioning low. We may give additional cells for those particular systems of the body. And so it's a comprehensive treatment that we utilize, and it isn't a thing that we're dealing with diseases. We're dealing with enhancing the health of the body. And we do this in a way that people begin to notice that they're having less symptoms and they forget about them. And I will review their questionnaire, 180 some odd questions, and they'll say, oh, I don't have that anymore. And so we are sometimes surprised how well they respond. And we never know how much they're going to respond, so we don't build up an idea that they're going to have a cure for this, a cure for that. We just say, we're going to deal with the body's health and enhance that health. And that's the way it works. And then they look and feel better, and sometimes the changes are phenomenal, sometimes they're very subtle, sometimes they say, well, I don't think anything happened. And then I'll go through their list of symptoms they had before, and they have disappeared.
Great.
You know.
Tell me a little bit about your chiropractic background and your schools and teachers.
I started studying to be a chiropractor in 1949 at Western States College, and I was there a semester and a half and ran out of money and came back to California where I lived in the mountains near Yosemite. I worked, and then in the fall I went back. I thought, well, I'm going to go where it's warmer, so I came down to the college, LA College of Chiropractic in Glendale, and I went one semester and went home for Christmas. Found out I was going to be drafted on the 3rd of January, so I enlisted in the Navy on the 2nd, and I went to school to become a corpsman for 5 months, and then I was at sea for 2.5 years. And while I was at the base in Great Lakes, I worked in the Dependence Hospital, helped deliver 300 babies, of servicemen. And so when I graduated from chiropractic college in Chicago, the National College, I thought, well, I'd become a chiropractic obstetrician, come to California, but they changed the law, and so I stayed in Illinois and went to work with another chiropractor and worked with him for 9 years, and probably treated twice as many patients as I would if I had my own practice, because he took vacations and I took over from him, and then I started my own practice and I had that private practice for a number of years, and then I gave that up after 50 years and working with the clinics. Now I'm 83. This is my retirement job.
Nice. And tell us about now your experience with Atlas Prophylax.
Well, I had Atlas Prophylax in December, and one of my patients from California had it, and she told us about it when she was in the Bahamas in December. So my wife, having an accident where I got hit so hard it tore the ligament that holds the atlas in conjunction with the axis, and so the transverse ligament of the atlas was detached. So I have an unstable condition, and so, but as soon as I had the Atlas Prophylax in Bloomington, Minnesota, the doctor Dr. Elijah asked me to walk down the hall, and when I did, I was dragging my left foot, and he said, "Do you have an orthotic in your shoe?" I said, "Yeah, because that arch has always been pronated." So I took my shoe off and took the orthotic out, and I noticed that my arch had returned.
Immediately after the treatment?
Immediately after the treatment. That's why I was dragging the foot. And so I haven't worn an orthotic or a lift in my shoes since then.
And you wore it for how long?
I had been wearing it since I started chiropractic college, and they had x-rayed my full spine x-ray and noticed that my left leg, my left acetabulum, was nearly an inch lower than my right. And so I thought that's what I have to do, is compensate for it. And now I don't wear that. And so I've been benefited. So I had the...
Good morning.
Good morning. Doing a testimonial of his experience with the method.
You ready to go?
Yes.
Yeah, in 2 minutes. So.
Okay.
I'm
Okay.
going to go with my son.
Okay, sounds
Okay.
good.
All right.
Okay.
So anyhow, I've recommended to patients, and Vladimir coming down this week, and so we ended up having some patients treated here, and so I would recommend this to everybody.
Thank you very much.
Okay.
Thank you very much, Dr. Johnson.